Did you know that more than 40,000 veterans were without shelter on any given night in 2017? Despite a high need for mental health resources, utilization is low. Research shows that more than 50% of veterans had a diagnosed mental disorder before they became homeless, and up to 92% had a diagnosis afterward. Homeless veterans typically have difficulty accessing VA services and mental health care. So, how can we bring the resources and know-how of the VA to these veterans in need? Hands up, who's played a game of cards before? If you're a veteran, you're likely raising your hand. This proposal is asking for $10,000 to create, distribute, and evaluate Cards for Connection. These cards will look and play like any other deck of playing cards with one key difference. The fronts of the cards will include 52 unique designs based on 5 categories: important phone numbers, positive affirmations, connect with others, distress tolerance, and grounding techniques. Every time veterans play a game of cards, they'll learn about resources VA has designed for them and here and now ways to cope with distress. To gauge response to this idea, we conducted interviews with VA employees who are veterans working with homeless veterans. I'll hand it over to them so you can hear their thoughts in their words.
If I saw a card that says breathe, I'm probably gonna take a breath. So my experience being in the military, we creatures of habits. If I saw this every day, sooner or later it's gonna stick.
Having the number of resources, having hotlines, having national calls, if you put it on the back of a piece of paper written on a bag, over time it gets worn, it gets torn, it gets faded, but then you actually have a durable set of deck of cards that has these numbers and it's more accessible, or they'd be able to pass it around or just keep it for however long they need it.
We will prototype and produce Cards for Connection using human-centered design methodology. We will assess acceptability and usability with our stakeholders, veterans who are at risk of or currently experiencing homelessness, and the VA staff who conduct outreach with them. In order to increase generalizability, we have compiled a team that represents diverse settings, including outreach personnel from each of 3 VAs. We also have expertise in human-centered design, evaluation, graphic design, and marketing. By December, we will have completed production and distribution and conducted initial user research. We will then be poised to make necessary enhancements based on user feedback and to conduct a broader dissemination and evaluation project. Cards for Connection deliver value in all 5 domains. They increase access to VA clinical services, which is particularly important for suicide prevention. This is a cost-effective method for distributing mental health strategies to veterans who are homeless. A public education campaign using playing cards could increase the efficiency of mental health outreach efforts. This veteran-focused product puts critical VA resources and mental health strategies directly in the hands of veterans in need. Finally, Cards for Connection would contribute to ongoing efforts to end homelessness among veterans and to address the tremendous unmet needs of this population. So, now that I've shown you my hand, who wants to be dealt in?